Hello, my name is Tiara Ely, and I'm a licensed practical nurse, currently studying registered nursing at Vermont Technical College. Today, I'm going to present a project that I've been working on for my technical communications course regarding standardized screening for postpartum depression. My project overview, we're going to go over the need for standardized testing for postpartum depression, a project description, the budget, a conclusion, time for questions, and references. So, what is postpartum depression and why does it matter? So, the World Health Organization actually states that the postpartum period is one of the most critical and yet most neglected phases of the lives of mothers and babies. Postpartum depression is complex, so it's a mix of physical and emotional and behavioral changes that occur after giving birth. They're attributed to chemical, social, and psychological changes associated with having a baby, and it is in the DSM 5 as a major depressive disorder, and there's currently no standard of screening for postpartum depression. So, due to evidence based practice, more clinics are starting to implement postpartum depression screening at the 6 week postpartum visit and potentially at the year postpartum visit. But this leaves a significant amount of time that mothers could go untreated, undiagnosed with postpartum depression. The most critical period after having a baby is 0 to 2 weeks. That's when most mothers will start experiencing some sort of symptoms, whether it's on the mild end of the spectrum, which is considered the baby blues, which is because of the chemicals and everything that I just talked to you about. There is some sadness that subsides usually on its own within 2 weeks. Then to a more moderate version, which is postpartum depression, which is usually needed to be treated with some psychological help with a clinical therapist and some medication. And then it goes to the far end of the spectrum regarding postpartum psychosis, and that's going to be our most severe. So, postpartum depression can manifest itself in many ways. It can manifest directly after birth, all the way up until a year later, which is considered the postpartum period. Some of these manifestations include chronic depression. So, that's going to be depression that's pretty consistent and going to have significant impacts in your life and in your health. Not wanting to be active, not having the same desire to interact with people or your baby. And it can last farther than the postpartum period. It can also lead to more severe stages of depression, such as postpartum psychosis. And that's actually going to be the most severe when the mother would need to be monitored 24/7 when they are with the infant, because it does put them at significant risk for suicide or infanticide. Postpartum depression also, it has a very pervasive nature. As with all mental illness, it's not something such as a wound that you can see, and you can kind of see when it's becoming infected. It's something that's discrete and really difficult to assess unless you have a good assessment tool and also the knowledge to understand it and to help treat it. There's also a lot of stigma that goes along with it, especially with social media in today's day and age. We have this idea that after having a baby, you're supposed to be overcome with joy. And the reality is that 85% of women do deal with some sort of mental struggle after having a baby. And it can range from the baby blues all the way to postpartum psychosis. So it's really important that we have more frequent screenings so that we are able to diagnose and treat women when they're really struggling in this very critical time. There's also a lot of effects that go hand in hand with untreated postpartum depression. So, impaired bonding is a huge part of that. So, mothers during that critical period, um, if they are not experiencing mental health issues, they're going to be really bonding. They're going to be nursing. They're going to be watching for the cues, feeding, changing, playing, interacting. And when a mother has postpartum depression, they can lack all desire to do so, which can cause issues. From the start and farther down the line. It also has an increased risk of SIDS. So, sudden infant death syndrome increases when a mother is dealing with postpartum depression. Also, can lead to decreased breastfeeding just because that mother lacks that desire to feel close to the baby. Um, and so, it can result in more health issues down the road, a higher percentage of allergies, autoimmune diseases, lack of immunity, not passive immunity firsthand. And that is from Derm and Chapman. Developmental delays. Just because of that impaired bonding and the lack of interaction between the mother and the infant, it can lead to cognitive delays, both initially and further down the line. So, what are we going to do about this? We have come up with this project idea to implement still the Eidenberg postnatal depression scale, which is the scale that is used, the assessment tool that's currently used at the 6 week postpartum visit when it is used. Um, but just doing it more frequently and having that be the standard. So it is going to be a requirement that it is done at the increments that I'm proposing. Also, continued postpartum depression education. So, for the staff that is already working, having that continued education course, which is actually wonderful for nurses because it adds on to the knowledge that they already have and makes them more valuable. And also, for this specific project, we're going to be hiring 2 new nurses for the postpartum depression nursing team. So they will be taking care of all of the assessment issues um, and dealing with the postpartum women. So, how does it work? What are we going to do to implement this? As I said before, we're going to use the Eidenberg Postnatal Depression Scale, which I have a copy of right here. You can overview it. And it ranges from a score of 0 to 30. And it's kind of vague. If a woman scores under a 13, then she's considered mentally stable or mentally healthy. 13 above, we're going to start looking into assessing her a little more and finding out what is causing some of these depressive issues. So we're going to work with her specifically. Some offices do the PHQ-9, which is just a patient health questionnaire that most physicians will use on anyone. But the EPDS is a little more specific for postnatal. So we're going to implement this EPDS scale weekly from birth until the first 2 weeks postpartum because we know that is the most critical period. So we're going to um, make sure that we're talking to the mother at least once a week and just asking her these questions, having a more holistic workspace and asking, what can we do? Can we help you with community access? Is there anything that you need? And then from 2 to 6 weeks postpartum, we're going to be doing biweekly assessments. So it's going to be a little less frequent, but still, we're going to make sure that we make time for her because anywhere from birth to that year, it is a possibility that she could be struggling with postpartum depression. And then from 6 weeks to a year, if she hasn't shown any signs or symptoms of dealing with postpartum depression, we're going to do a monthly assessment. Some of the assessment styles that we are going to implement are outpatient. So the mother can come to us to get assessed, and we can kind of help her in office. We can also do telemedicine, which is really wonderful for new mothers because they might not feel comfortable getting out of the house, especially in a time like now where we're in a pandemic. And it's so much easier, so much safer to just have this telemedicine. And yet we can still see the nonverbal cues. We can still interact with the patient and understand what's really going on a little better than if we just had a phone call. And then home visits, which are my personal favorite. Um, which is going to include the nurse team would be going to the houses and really getting a good overview of what's going on and how they can help. So why are we doing this? Um, 1 in 7 women experience undiagnosed postpartum depression. And so, since we know that, and also that 85% of women deal with some sort of mental health issue after having a baby in the first 2 weeks, we really need to start focusing on the mental health of these women and getting better access to diagnoses, which means that they can have better treatment and better outcomes for the mother and the baby. And on the right is just some of the ways that if a woman is dealing with postpartum depression, she can get that support. So, psychosocial, cognitive therapy, interpersonal psychotherapy, and home visits. So, the budget that we have is $45,000 per new hire. So, we'll need two of the new nurses, the postpartum depression specialized hires, and then $500 per current employee for the continued education. So, they will get a continued education certificate that will go on to their nursing degree. Um, and so overall, our budget is 120,000. So overall, this project and implementing the frequency of postpartum depression assessment, it's really going to improve the quality for postpartum women and the newborn baby by reducing the risk of postpartum depression being undiagnosed. So getting treatment that is necessary to help her heal and be able to care for that baby. It's also going to improve the access to mental health treatment in the postpartum woman and decrease the risk for harm to the infant and the postpartum mother. So, we're going to see a lot of patient improvement and just overall better patient centered care and safety. Questions? Thoughts? Thank you.